Good afternoon. I will be talking to you today about a horrible disease called DIPG. I had never heard of this until about March 2014 when my family was given the news that my 5-year-old cousin was diagnosed with it. Um, the next 9 months were pretty terrible, to say the least. What is DIPG? It stands for diffuse intrinsic, hard to say, pontine glioma, um, which is located in the middle of the brainstem. Diffuse meaning the tumor is not well contained and can spread into other parts of the tissue. Uh, Cancer cells, which mixes with your healthy ones and pretty much spreads. Pontine means the tumor found in the pons of the brainstem are responsible for a number of important body functions, which can affect your left side or right side of the body, which in this case affected his left and then slowly to his right. It also affects your balance, eye movement, heartbeat, and swallowing. And we found that out by he was having trouble, like his left side was drooping down his face, so that's when we took him in. That's when he was diagnosed with it. The pressure of the growing tumor is very dangerous. Glioma is generally a term for originating from the cells which are found in the brain. And they make up the white matter of the brain that surrounds and supports the neurons, which are cells that carry messages in the brain. And DIPG is primarily affects children between the ages of 5 to 10, mostly in children, and 10 to 15% of the brain tumors in children, um, they usually make it. And so if you get it, then it's usually not the good news. It's very aggressive and interferes with all bodily functions, and it grows and puts pressure on the nerves that control the body functions, which deprives a child of the ability to move, communicate, eat, and drink. Um, as the tumor progresses, it also interferes with breathing and heartbeat, which will eventually lead to death. Causes of DIPG. Researchers do not know yet what exactly causes it, which is the main reason that most people do not survive it. Um, Unlike any other cancer, there is no evidence that it is caused by environmental factors. How to diagnose DIPG? Until a few years ago, we did not perform a biopsy on the diagnosis of DIPG. Instead, diagnose it in a patient symptoms and MRI scans, which gives detailed images of the brain. And there are seriously neurology damages was high. There was little benefit because the results of the biopsy did not affect how the patient was treated, and the biopsies are becoming more common today than what they have been. Um, and the guided into the tumor to extract cells by drilling a hole in the skull, which is what they had to perform. And then the treatment for DIPG. A DIPG tumor cannot be removed through surgery for two reasons. One, because the pon is located in the center of the brain, so the surgeon cannot go in and remove it without damaging any other parts of it, which is the main reason. And then two, if the tumor could be accessed, total remove would be impossible. A DIPG tumor is not a solid, well-defined mass tumor. It spreads between healthy cells and um, those cutting out healthy brain cells, which will lead to eventually affecting the whole body. Radiation is the only proven treatment for it. In 70% of the patients, it causes the tumor to shrink, which provides relief of the symptoms, but unfortunately, for only a short period of time, usually a few months, and then the tumor starts growing again. Radiation typically extends their life by 2 or 3 months. They're not real sure. And then chemotherapy. In the past 30 years, DIPG patients have participated in using a variety of chemotherapies, drugs. None have shown any benefits for them. And the cure and survival rates. There's currently no cure for DIPG. The median survival rate is 8 to 11 months, which in his case he was, I think it was 7 or 8 months. I'm not real sure there. A child is diagnosed with DIPG today, has the same as what it was 40 years ago. 10% of the children survive, and not a very good rate. I actually have a picture of my cousin. His name's Gage. He was diagnosed on March 22nd, I believe, 2014. After his leg would give out and then he would fall frequently. He went to Riley Children's Hospital and an MRI was done. He was diagnosed with DIPG. And then he went to St. Jude's in Memphis, where he received 6 weeks of radiation therapy, along with large doses of steroids. It did shrink for several months, but then came back, like I said. And it was very difficult to eat and drink and do all sorts of stuff. He was very aware of everything going on, and he passed away on December 26, 2014, just a few days after his 9 months of diagnosis, at the age of 6. And that is my information on DIPG. I hope you enjoyed. Thank you.